All right, guys, let's just get started. So welcome everybody, and thanks for joining the 2026 FreeMockMMI Workshop. My name's Asad. I'm a third year mid student at the University of Auckland. And today I'm going to be running this workshop with my other peers from FreeMockMMI. So that's going to include Andy Tao, Angelin, Zed, um, Paul, as well as Dhananjay. So we're going to be running this workshop to help you prepare for the MMIs. The MMIs is one of those key hurdles in the admissions process, and it's really important that you learn it well so you can do well. So the goal today is to demystify the format of the MMI. We're going to walk you through what's actually being assessed. We're going to give you some practical tools to use in your prep and how to answer the questions well. And then in the second half, we're going to have some breakout rooms where you'll get actual feedback from clinical students who've done the MMI before and have succeeded in it. So here's a quick overview of everything that we're running through. We're going to get started with the key skills that the MMI is designed to assess. We'll run you through the basics of the MMI. We'll give you some types of stations that you might encounter. And then for each station type, we'll be diving into frameworks and tips. And then after that, we're going to be doing those breakout rooms where you'll actually get to practice in front of some other people, as well as a clinical student who's going to be giving you feedback. And at any point, if you have any questions, please drop them into the chat and we'll answer them. So let's just get started. So this is some of the stations that you might face. There's 8 total stations in the MMI. One of those is a police vetting station, so that's why it's not included here. It's sort of like a break station. So the possible stations that you can get are career choice, equity, personal insight, personal experience, hauta mauri, moral, ethical, and healthcare issues. And oftentimes each question can have a bunch of different things seasoned into them. They're not always, so clean cut. And of course, the University of Auckland website is always going to have the most up-to-date detail on this. And there's a document that we'll share later and that you should really read before going into the MMI so you know what's expected of you directly from the university. The key takeaway we want you to get from today is not to memorize a script for each station. We want you to have a bunch of flexible frameworks that you can apply for each station so you can do your best in the MMIs. So let's get started with the basics of the MMI. So the MMI at UOA is conducted online. You're going to have 8 stations total, as I mentioned before. That police vetting station is just a standard background check. There's nothing to really stress about. The critical thing to understand is that each station is completely independent from each other station. So if you do poorly in one station, it doesn't matter. It's not going to carry over to another station. You're going to get a clean slate every single station. So for each station, you'll have a question that's going to be presented to you. You'll have 30 seconds of thinking time and then 3 minutes to give your answer, which is then recorded for a reviewer to mark. That 3-minute window sounds pretty long, but the thing is, it's going to go really fast, especially if you're nervous. And that's why we want you to practice. So these are the 12 attributes that the MMI is designed to assess. So this is a bit different from scenarios. Attributes are sort of the skills that they want to see you having, whereas scenarios is sort of what the questions revolves around. So I'd really recommend you familiarize yourself with this list because it tells you exactly what the reviewers are looking for. There's nothing here about science or stuff you learn about in lectures, right? It's entirely about who you are as a person and who you are as a future clinical student. So it's going to be about stuff like how you communicate, how you reason through ethical problems, how you understand equity, and how you collaborate with other people. There's lots of really important ones here that you really should know thoroughly. So how do you prepare? The most effective type of preparation is active practice with other people. Really, really important to actually practice speaking, practice saying your answers out loud, not just typing them up into your notes or writing them down in your notes. So, get together with classmates, get together with friends and people you know, and either generate questions or, go online. There's heaps of free question banks. The FreeMockMMI website has one, and we'll talk about that later. And try to talk to each other through timed responses and give each other feedback, right? By actively speaking and by actively answering questions, you're much more likely to learn well. And yeah, that 3 minute window is going to feel completely different when you're actually in the seat speaking versus when you're planning in your head. Another thing would be to stay updated across current healthcare events, especially health related stuff in New Zealand. So, stuff relating to Māori health, mental health, healthcare workforce, and that sort of stuff. And, we'll be talking about that later in the healthcare issues station. And of course, sign up to the main FreeMockMMI event. We've got a bigger event later on the year, a couple of weeks before the actual MMIs, where it's literally a huge free mock MMI. It's really helpful. Lots of people find it really, really useful. Yeah, so time allocation is really important as well in the MMI. It's its own skills. So you've got 30 seconds to prepare, and that's really, really short. In the past, you used to have a lot more time to prepare, but now you don't. So you really want to identify what the question is asking, and you want to sort of have a rough direction that you want to take with your answer. You don't need to have a polished plan. You don't need to have like a polished script in that 30 seconds. You just want to structure about, okay, I'm going to talk about this and this and that. And then you're going to have 3 minutes to answer. So you don't have to cover every single angle of a question. The reviewer is going to be much more interested in the actual quality of your reasoning than whether you've hit a checklist of every single angle. So as long as you have a few well-reasoned, clearly articulated points, that's going to score a lot better than rushing through, 10 surface level points, right? And again, always make sure you practice with a timer. It's the only way you're going to get an accurate sense of the pacing of the MMI. And make sure you practice with a timer for both the preparation and the actual speaking time. Okay, so I'll pass on to my colleague Angela to talk about career choice.
Hi everyone, my name's Ange, and I'm going to be taking you guys through some tips and ideas on how to structure your responses to two of the possible stations. So we're looking at career choice first. So yeah, so the question's probably going to be something general about healthcare professionals rather than a specific question about your career. Because I'm pretty sure the reviewers don't know what program you're applying for, so it'll be something like, why do you want to be a healthcare professional rather than why do you want to be a doctor? So just to clear that up. So some general tips to work through first is reviewers don't want to only hear about your academic achievements or grades because they know you do well academically, which is probably how you've gotten an MMI interview in the first place. But what they want to hear about instead is how you're a well-rounded person. So that could be things like extracurriculars and hobbies that you have. So by kind of explaining your extracurriculars, you can show how they help you to foster better relationships with those around you, and then how that can relate to future relationships with and interactions with your patients. And examples of things you can talk about could be a part-time job, sports teams, volunteering, leadership roles, maybe some organizations you've joined. Talking about things like that is really good for this section. And for each of those extracurricular non-academic pursuits, you want to link it to how they would help you in a career in healthcare. So making those links, because ultimately we want our healthcare professionals to be well-rounded and to have that good work-life balance. So yeah, for this section to prepare for it, I'd really take time to think about what you do outside of your study that has helped you develop into who you are, given you your personality, things like that. And it's also really important to have extracurriculars for good mental health. So that's also like a nice thing to link to healthcare professionals because it's really important to maintain good mental health. So yeah. Um, another, sorry, can we go back? Can we go back? Okay. Yeah, another good way to respond to questions in career choice is going through the pros and cons of your chosen career, because obviously it's not all positives for a career in healthcare. There are negatives, and it's great to show awareness of that. And it shows that you've really thought about your career and understand that, you haven't just blindly romanticized it, that you've understood that there are negatives as well. And at the same time, a pros and cons question helps you to discuss what motivated you to a career in healthcare. What are the pros that have attracted you to a healthcare career? And also, you really want to think about what values and characteristics does a healthcare professional have, and do you think you have them? Have your extracurriculars help you develop them? Things like that. And next slide, please. So an example structure to help you answer a question in career choice is P star, which is point, situation, task, action, and reflection. So if we had a question like what inspired you to pursue a career in healthcare, this is a pretty general question, and so you'd be lucky if you got it, but we can just work through an example. So P, we want to say what actually inspired you to pursue a career in healthcare. So, for example, it could be something like wanting to challenge yourself in a career or chasing more knowledge. So that's your point. And then for situation, you want to talk about a personal experience of something that's happened to you that's maybe solidified your interest in healthcare. And then to explain a bit more, you could go to tasks. So, what did you do in the situation that you found yourself in? Action, how did you respond in this situation? And then reflection, what values or lessons did you learn? And ultimately link it back to the main question stem. Next slide, please. And then empathy is really important for all your questions that you're answering in the MMI, but it's important to show that you really have understood the reality of a healthcare professional. You know that it's not easy. There's a high workload, intensive hours, and there are emotionally distressing situations. So having empathy, understanding that, and addressing that in your responses. So if I were a healthcare professional, I understand that it'll be hard to find time to do things like that. So next slide, please. So the next possible station is Hawara Maori. And next slide. For this section, it's really important to recognize the inequities between Maori and non-Maori for health outcomes. So I'd recommend that you do some research and just kind of look at the statistics that exist for the differences in health outcomes. I think it's quite important to actually understand and see how the inequities are existing in our current society. And not only do we need to recognize the inequities, but we need to understand why these Maori health inequities exist. So this is where we draw in an understanding of Te Tiriti o Waitangi and the mistranslations between the Treaty of Waitangi. So I think it's really important to have a solid understanding of those mistranslations and how they have led to the barriers to accessing healthcare that Maori individuals might have in today's society. So by addressing these barriers that exist in society, we can also come up with interventions on how we could alleviate some of the health inequities that exist. And so interventions, like an example of an intervention would be the MathPass program. And it helps reduce some of the barriers to Maori, to becoming health professionals for Maori, and it helps culturally appropriate care and things like that. So have some time to research some interventions that exist or come up with some interventions, more funding, things like that, to help alleviate some of the health inequities that exist. And for this section, when structuring your response, it's really important to show a trend and a flow from the basic causes of these health inequities, so colonization, Treaty of Waitangi, things like that, and how they have led to the systemic racism or health inequities today. So next slide, please. So we can go through an example structure. So this is a different framework. It's PEAL, which many of you guys have already done before, I'm sure. But if we have the question, why do Maori continue to have higher rates of metabolic disease? We can work through an example. So the point would be recognizing that there are health inequities. So Maori have poorer health outcomes for metabolic diseases compared to non-Maori. That would be your point. And then, for example, we can explain some of cause the reasons these inequities exist. So some barriers to accessing healthcare, maybe there's a lack of culturally appropriate care. Yeah. So in which ways is our health services not equal for Maori and non-Maori? I think that would be good to say an example. And then for explain, this would probably be the bulk of your answer is explaining the processes of colonization to Tiritio Waitangi and how those fundamental causes have led to the inequities we see today. And then to link, we want to talk about how we can respond. So that's where you bring in those interventions, those ways that we can help alleviate these inequities. Yeah, next slide, and I'll pass it on. Oh, yeah, just remember throughout to have empathy. You don't want to do victim blaming at all. You want to recognize that it's not fair for these inequities to exist and how it must be hard to access healthcare and the kind of implications of that for Maori individuals. So, yeah, next slide. Pass it on to Andy now.
Hi guys, am I audible?
Yep, we can hear you.
Okay. So yeah, my name is Andy, and I am also a third year medical student at University of Auckland. So I'll be talking to you guys today about moral and ethics. So next slide, please. All right, so when it comes to moral and ethics, there's four fundamental pillars that you have to think about, and those are beneficence, or to the responsibility of a healthcare professional to do good for the patient, non-maleficence, which is the responsibility to avoid harming the patient, autonomy, or basically giving the patient their freedom and their choice of treatment, and justice, which is ensuring that the healthcare system is fair and trying to do the most amount of good for the most amount of people. And so beneficence and non-maleficence feel like they're the same, they're two sides of the same coin, you know, but there's a small difference over there. So for example, if like say someone needs a surgery and you're doing the surgery that saves their life and does good for them, that would be an example of beneficence. Whereas non-maleficence would be if they were, let's say they're in a lot of pain and they're asking you for opioids, asking you for like fentanyl, and you avoid giving it to them because you are scared that they might overdose and die because of respiratory depression, that will be non-maleficence. And so, in different situations, it kind of depends on the situation which one you are applying. And autonomy, I would say, is arguably the most important pillar because the truth is, you might be faced with a situation in which, let's say, you have a Jehovah's Witness, which are a group of people who refuse blood transfusions. And they might get in a car crash and they lose a lot of blood. And then you would, maybe their parents or their family wants them to get a blood transfusion, or maybe because you need to give it to them, you want to give it to them to save their life. But of course, they can't get it. And that's their autonomy to do so. And you can't really intervene when it comes to that. And so ultimately what you want to do is you want to weigh both sides of the argument and examine the outcomes and then pick a side based on the situation and based on those factors. Basically, like if let's say beneficence and justice come into conflict with each other, you want to choose the side which weighs more or which you evaluate as being more important. And so there's two ways to do this, right? One way to do it is to pick one side and then justify your position. And then another way to do it is to, first of all, justify all your points. Basically, compare the points first, and then at the very end of your argument, choose a side. And that's a one that I personally prefer because sometimes, like I remember when I was doing the MMI, I would not really know what side to pick at the start, especially with like really complex moral questions. And what I would do is I would just show them my thinking, and it kind of buys myself more time as well to actually choose which side that I want to pick. And so some examples of this could include abortion, professional misconduct, like if you see your colleague cheating or faking data, etc. Patient confidentiality, that's also another big point. telling the truth, integrity, religion, etc. All right, so some considerations. Overall, your choice, does it show respect for the patient and their right, their autonomy to make their decisions? And think about if it harms the patient, so that's non-maleficence. And does it benefit the patient? That would be beneficence. And is anyone especially disadvantaged or harmed? And that will be under the point of justice. And can you recognize the overall ethical implications? And I would say that despite the fact that there are four very clear pillars, you don't have to use the specific words every single time. Like, because if you use the word beneficence every time, it would seem like a really rigid answer. And I think the interviewers don't really want that. They just want to see that you have a good overall understanding of what's going on and how these four pillars interact with each other. So next, please. All right, so the example structure for this question, should people be able to pick the gender of their baby via IVF? So, of course, you start with a point, and just to recognize that this is an ethical dilemma, and explain kind of why it's an ethical dilemma as well, give a basic context. So, I will probably say something like, there is some gender inequity in society, and there are probably many parents who prefer one gender over the other. And in that case, if given the option, they would create a choice. And however, that choice can be considered eugenics. And of course, while it gives them their autonomy, like it is like ethically considered eugenics, right? And it also can create some society implications in the future. It could potentially create like gender imbalances or reduce fertility rates in the future, etc. And so, but the overall structure you want to do is, like I said, like create an example and then just explain your example. And you, of course, can do multiple examples. And what I would do is just example, explain, and just do that. And this diagram might not show it very well, but you want to do both yes and no. You shouldn't just focus on the yes side. You want to also think about why someone could agree with the no side. So just recognizing both sides of an argument and that there is an ethical compromise is a very important thing to do for these ethics questions. Next slide, please. And yeah, I don't know why this is here, but empathy, you always need it. I think this is a duplication issue between the slides. But of course, you can't really emphasize it enough that you want to show empathy for all these questions. Although I would argue it's more important to do this for Angelin's career choice and personal experience parts. Next, please. All right, so the next topic is on equity. And so the difference between equity and the more common word, which is equality, that we're more familiar with, is that I'm sure you guys all have learned it in Pop Health 111 and remember some things about it. It's just that equality refers to giving the same treatment for everyone. So let's say you have a rich person and you have a poor person, and you give them both the same amount of money. So that would be equality, right? But you will end up with a rich person still having more money than the poor person, and the gap stays the same. And so the inequity still stays the same. And equity would involve, on the other hand, it would involve giving the poor person more support so that you reduce that gap between the rich and the poor. And that's what equity is about. And next, please. So you may be asked a question on a social issue. So, for example, the gender pay gap, a pretty big equity issue, or it could be on prisoners' right to vote, etc. And the key thing to note is that you won't really be judged on which side of the argument you pick, because again, same with the ethics questions, there is no singular right answer. It's all about how well you can argue and how well you can justify your points, and reflect on both sides of the argument. And of course, if there is something that is obviously politically correct or politically incorrect, like you should never say something that is outright bad. You should always be focusing on how to improve society and create the most equitable outcomes. And so some considerations would be, can you see both sides of the argument? Are you socially responsible? So just think about how the communities are affected by this and all the different stakeholders. Stakeholders are basically the people who are most affected by this topic. and you want to use words like improve XYZ for this vulnerable community. Like, these kind of phrases are really crucial. And just think really critically and talk with passion, but also with logic. So show that you care about the issue, but definitely also address the fact that counter arguments do exist. And also, yeah, that's the same as the next point. Just acknowledge that there are views that are different from yours. And finally, you want to show that you are flexible with the topic. So even if you choose a side at the very start, you show that your side and your position can change. So it's like, if you keep on talking and then you realize, oh, wait, shoot, what I said before was actually not correct. Just correct yourself. Like, don't just go full in with what you said before that was wrong. Like, show that you have the flexibility and the humility to learn from your mistakes and to change. Next slide, please. Okay, so an example would be rural communities often lack access to mental health services. So the key issue, of course, is that there is an unequal access to healthcare resources. They have less doctors, less hospitals, which are further away from them. And then define the problem. So that would be, like I said, what's the difference between equity versus equality, right? Just explain, kind of define what that is. And then why is there a lack? Of course, that's kind of self-explanatory about rural areas. And then thirdly, recognize the stakeholders or the most important people who are affected in this topic. So those would be the patients who are, seeking mental health help, or it could be patients of certain ethnic minorities like Maori and Pacifica. It could be the healthcare professionals themselves, the doctors who are working in those regions, their families, and like the overall system of New Zealand, which decides the policy and where the money and the resources go, etc. And you want to provide your opinion as to whether or not this is fair and just, and who should be prioritized, especially. Is it the entire rural region, or is it like a special, like, this individual subset of the rural region, or Maori people within the rural region? Like, just think about that as well. And overall, you also want to think about I don't think it says on here, but you want to think about the reasons as to why this inequality exists. Oftentimes, they will make it more clear that you want to talk about this. So that would be like the 5 A's of access that you guys learned in Pop Health as well. So availability, accessibility, acceptability, etc. And then finally, discuss the short-term and the long-term solutions. So short-term solutions could include just, subsidizing the rural program for healthcare professionals and just giving them more incentive to move to rural regions. And the long term could be something like improving the infrastructure in the rural regions and making the lifestyle over there be more appealing so that people would actually move there on their own accord. And so you kind of see how solutions can be differentiated based on that. And yeah, next slide, please. So now I will be passing it on to my colleague, Paul, who will be talking about personal experience. Thank you very much.
Thank you. All right, cool, guys. So, hi, guys, I'm Paul. I'm also a third year medical student. And so today I'll walk you through the personal experience section in the MMI. So, next slide, please. So, yeah, this station is exactly pretty much what it sounds like. You're going to be asked to describe something that's happened to you in the past. So, that could be something along the lines of think of a time you played a role in a team and what was your contribution. And so through your past experiences, you really want to be able to reflect on the way that you acted and, to demonstrate your personal qualities and show those attributes that Osage showed at the beginning. So, sometimes you may also be asked to describe either a positive or a negative experience. And so it's really important if you're going to speak about a negative experience to make sure that it's something you've been able to overcome and you're comfortable sharing. They want to see how you've learned and been able to grow as a result of that negative experience. And so, yeah, do keep all of this in mind. Yeah, and as long as the experience you choose, like it addresses what the question is asking for, then it doesn't really matter what anecdote or example you give. What's really important is you being able to use the example you give to, really demonstrate and highlight those attributes and your personal qualities. So that could be like showing resilience, personal growth, self-reflection, and how you were able to adapt to the situation, and whatever you see fit in the context of the question. So some other considerations you may wish to consider when you're answering a personal experience question include, what was the setting? What part did you play? Did you have to, take into account other people's perspectives in the experience? Um, yeah, did you learn anything new, and how this experience will help you as a health professional? Next slide, please. So yeah, the next station is going to be personal insight, and not gonna lie, this station is pretty similar to personal experience. So the way you wanna, sorry, next slide. Thank you. So the way you want to approach is pretty much the same, same technique. So you want to have some key examples and anecdotes ready, which you can use to talk about your personal qualities, your interests, and your inspirations. And so, yeah, examples of questions you maybe ask could be to think of a situation where there was a conflict in a group setting and what you did to resolve that. So, again, you'll be drawing upon past experiences. So, some good things to be able to talk about would be your strengths and your weaknesses. Um, yeah, and what aspects of your career could be challenging, and I think I talked about that already. So yeah, just make sure when you're talking about a weakness that be careful to not choose a weakness that you've like you don't have a plan or you haven't got anything in mind to work upon to improve. And so just be clear on what you choose. So next slide. Cool. And so how to tackle personal questions. And so for both personal experience and insight questions, the way that I personally approach them was basically just to brainstorm as many anecdotes as possible by, practicing as many questions as I could. And you'll find that it won't take you long before you can trim the list of experiences and anecdotes you use down to just a few that you can basically just store in your brain as like a memory bank. And then you can use them, retrieve them quickly to basically shape and answer any question that you get given in the real MMI. So it's really important to be able to, just quickly retrieve and recall those experiences because it was hard enough for us back then when we only had 2 minutes of thinking time. This time you guys are only going to get 30 seconds, and so you don't want to waste any time to, piece together your memory and piece together how a particular experience occurred. And so yeah, once you do decide on an anecdote that you want to use, go with that and then start thinking about how you can bring your personal qualities, your attributes. And then when you start talking about that, the more you can talk about those, the higher that you'll be able to score. So yeah, in the end, it's mainly just about getting experience with these type of questions. It can be scary and daunting talking about yourself if you're not used to it. So just practice, practice, practice. Next slide. And I think I'll pass on to my colleague Zaid.
Thanks, Paul. With with the ends of the health issue section, it's a bit different to the other sides or other questions that you might get, mainly because this one sometimes might require you having some background knowledge from different things happening in New Zealand at the moment. So we'll go through in the next slide of what some potential examples are. But generally, for the NZ health issue section, what they're looking for isn't so much how much knowledge you know about a certain health issue or what your specific opinion about it is, but it's mainly how you go about arguing either for or against, or generally how you present your argument for whatever the NZ health issue is. So the main thing that they're looking for perhaps isn't so much empathy, but mainly critical thinking and how you can apply past knowledge or current knowledge and assess a certain health issue that's going on in the country at the moment. And primarily because you're all applying for something to do with clinical studies, it's also important to have a really good, solid understanding about the current healthcare status in New Zealand. So things like funding, the way that the hospitals work, um, things like allocation of resources, inequities. So this question combines a lot of the different sections together. And again, as I mentioned, it's quite good. It's quite an advantage to have some really good background knowledge of current healthcare issues in New Zealand. And some things might involve the more ethical side of healthcare. So again, like I mentioned about resources, how do you allocate resources to certain groups? For example, if there's multiple ethnic groups that are facing inequities, how do you decide which one you should allocate resources to, or which one should be allocated resources first prior to everyone else getting a chance? So how you can excel on this type of question and how you can do well, there's a couple of key considerations you can think about. The first one's quite generalized and quite simple, and I recommend everyone to do it, and that's just keeping up to date with what's going on in New Zealand. It doesn't have to specifically involve healthcare. It can be things like, I mean, obviously, and recently in the news, you can read things about waiting time in the hospital, and how that's got different healthcare impacts on patients and families. How you can really keep up to date, you can read the Herald in the morning, watch the news, um, discuss with your friends and family what their opinions are, what their views are. That gives you a different perspective, perhaps, from what you have, and it helps you build a really good database and knowledge bank for whatever type of question you get, you've got a solid approach to it. So if we go to the next slide, there's some examples of the type of things to consider. Things like strikes comes up all the time. And it's also featured really prominently in the news. So having an understanding of why strikes exist, what their purpose is, what the aim is, and try having a think about whether you can argue for it or against it, or generally the way that you can present an argument for the strikes. And again, that relates to staff shortages, how that affects patients, and how it affects families. Things like smoking, mental health, waiting times is a major one, and it's quite a recently topical one if you do have a look at the news. So it wouldn't be a surprise if there's a question on wait times and the impact that has on everyone surrounding it. It's really important to consider different perspectives. So you might get a question and you might have a really strong opinion about it, but the interviewer or whoever's marking the question, what they prefer to see is you're able to approach it from a lot of different dimensions. It's good to have one really strong, solid opinion, but the fact that you're able to show that there's both pros, cons, benefits, negatives, that shows a lot more critical thinking. And you can always emphasize that one might be better than the other, but it's really important to show that you're really multidimensional and you've got a lot of different perspectives. It's good to point out what the areas of concerns are, so what needs a lot of work. And it's really important also to mention that currently the reason that there might be some healthcare issues is primarily because there's a lot of barriers to either new policies being implemented, or for example, barriers to why there is such long wait times. And that all relates back to staff shortages, why we've got healthcare strikes. So do your research and try to combine everything together. But I think the main takeaway from this one is it's slightly a little bit lighter and easier than the majority of the other questions, primarily because if you carry that principle about having different perspectives, being able to tackle questions with a lot of different dimensions and perspectives, I think you'll be pretty sweet overall. Next slide.
Cool. So I'll be doing this last station. We'll be talking about the LGBTQ station. So this station isn't really a separate station that you would think of, but there's typically one station that will be having the context of LGBTQ. So it's really important that you understand these questions and you're able to answer them well. So the core purpose of the station is to assess whether or not you can make patients who happen to be LGBTQ feel safe and comfortable, and you want to think through everything from that lens. You should be understanding the patient's needs and how to protect them, and also understanding the specific barriers to healthcare that they experience and sort of the previous harmful healthcare experiences that they might have had, which would make them less comfortable and less confident and less trusting in the healthcare system. It's always good to be able to give examples. You can search up stuff. Some good examples would be stuff like blood donation. There's been some changes because, like, sort of to help the inequities in the LGBTQ patients face. So it might be good to read up on that. In a practical sense, you want to make sure that you use inclusive language at all times. Don't say anything bad. Don't make assumptions about patients' gender, sex, name, pronouns, that sort of stuff. You can introduce yourself with your pronouns. That is something that some people do. That can help sometimes. But yeah, some of the main considerations I make is, am I using the right language? Am I being inclusive? And am I referring to people with their preferred pronouns? And yeah, just like a lot of the other stations, and especially so like the previous station, just being up to date with issues that this group of people faces and the challenges that they face would be really great. So that's sort of the main stations. We'll now talk about where to get some solid resources if you want some more help and some more practice. So of course, we've got to plug FreeMockMMI. So we've got a website, it's called the freemockmmi.org.nz. You can Google us or find it through our Instagram. So we've got a big question bank, and that's really great for you if you want to practice either by yourself or with family or friends. So make sure you search that up and use it. You can also find us on Instagram, like I said. Yeah, and we've got plenty of other programs. We've got the buddy program. We've got the main event. Sometimes we'll post stories about like a day in the life of a clinical student. So there's lots of stuff going on. So make sure that you follow us and keep up to date with the stuff that we have. This is a tool that we made last year. It's sort of like a question simulator where you can sort of practice by yourself. And it gives you a timer, and then some people have found it quite helpful. So if that's something you're interested in, I think these pictures are a little bit outdated. The document looks a little different now. But there's this main document about the MMI that the university publishes, and it's really important to have a read of this because this is sort of the only official guidance from the university that they give on the MMI. So it's publicly available. Please make sure that you check it out at least once. But yeah, that's all for the first part of the workshop. I really hope everyone enjoyed it and found it useful. Please note that we're going to be sending out feedback forms by email, probably later today, maybe tomorrow. And we'd really, really appreciate if you could fill those out so we can understand where we went well and where we could improve on so that we can create better events for you in the future. And also we can make a better workshop next year. So now we're moving on to the next part, which is the breakout room section. So this is where you're going to be putting everything that you learned just now into practice. You're going to be split up into small groups. You'll have a clinical student who's going to be volunteering, and they'll give you questions, and you'll take turns answering with a timer, and the clinical student will give you some feedback. This is a really important section of today. Passive listening only gets you so far, so please make sure you try practicing. Even if you're not ready, even if you feel like you're not prepared for it, just give it a go. It's better to get some sort of practice instead of no practice at all, okay? It's a really rare opportunity to get feedback and advice from someone who's done this MMI before and has done well in it. So please make sure you utilize it. Yeah. So we're going to get started promptly at about 1:55 p.m. We just want the volunteers to start streaming in. So until then, go ahead and just have a short break, and we'll move you into the breakout rooms at about 1:55. Thank you so much, and you can just pop any questions that you have into the chat.